This week, we're talking about the addiction crisis in Oregon and Washington. Tonight, let's zero in on fentanyl. As we've been reporting, the use of fentanyl has increased dramatically in the past decade. Nationally, fentanyl is killing people at an unprecedented rate. 66% of overdose deaths in 2021 were related to that drug, according to the CDC. And today, the Drug Enforcement Agency declared the first ever National Fentanyl Awareness Day. Health officials are now saying that if you're taking drugs that you got anywhere other than a pharmacy, you should assume they contain fentanyl and take precautions. It's possible that you know someone who either does drugs or is at risk of becoming a drug user, your kids, their friends, people in your community. And while not using them is the best answer, addiction's complicated, and ignoring the issue is a bad idea. Some health experts say if users are going to take drugs, it's important to make them as safe as possible, especially when it comes to fentanyl. We talked today with Kelsey Young, a harm reduction supervisor for Multnomah County.
Harm reduction has shown to increase access to treatment up to 5 times. So for someone who's coming into a syringe exchange program regularly, they're 5 times more likely to end up in treatment than someone who is using and is not engaged in any kind of harm reduction. So what we do know is that having that support and non-judgmental approach to engaging with people is beneficial to their health outcomes.
Harm reduction means that instead of sending drug users to jail, they're provided ways to use drugs in a safer environment. That could be needle exchanges to prevent blood-borne diseases, or in the case of fentanyl, supplying Narcan and then fentanyl testing strips. Narcan is a nasal spray that you can get at the pharmacy. It reverses an opioid overdose. Some health insurances do cover the cost. You can also get it from a harm reduction clinic. There are several throughout Oregon, and there's an ongoing effort to get Narcan into the schools. Fentanyl testing strips can tell if the drugs you're using contain fentanyl. It's not a perfect system. It works better for some than others, but Young says it is a good place to start.
You're going to pull out a small strip that looks like this. And what you want to do is dilute whatever substance you're using into some water. So it's about 1 teaspoon of water along with about 50 milligrams of the substance. And you're going to mix that into, you can use one of the little tins that we provide or a bottle cap of some kind. And then you're going to be dipping this strip into it. When you do that, if there is fentanyl present, you're going to get a result with 1 red line like this, and that will tell you that fentanyl is present in that sample that you just tested.
You can get fentanyl test strips at harm reduction clinics throughout the county. They're also available, they're not available, in pharmacies, but you can get them online. And one more thing, whether you use drugs or not, be aware of the signs of an overdose. It only takes a few milligrams of fentanyl to kill a person. It's about the size of a few grains of salt. When someone is overdosing, they stop breathing, so they get limp. Their skin turns pale or blue, especially their lips and fingertips. They might lose consciousness or vomit or foam at the mouth. If any of that happens, you need to call 911 immediately. And if you have it, use Narcan. Oregon also has a Good Samaritan Law. That means that you will not be prosecuted if you seek medical help for someone who's overdosing. Young says harm reduction, like the fentanyl test strips, is a better approach than putting people in jail.
We understand that this country has taken an approach to criminalizing substance use, and in the past 50 years, what we have seen is that the war on drugs and the approach of criminalization of substance use has not stopped the increase of substance use in our country. So we believe that taking the approach of empowering people to have tools to reduce their risks, as well as meeting them with respect and support, gives them the opportunity to explore avenues for decreasing their use, using safer, and possibly getting into treatment so that they can stop substance use.
If you or someone you know needs help finding treatment, a good place to start is the Alcohol and Drug Helpline with Lines for Life. That number is 1-800-273-8255.